it was almost like 3 or 4 years ago. I was really unhappy. I think I was a freshman in college. I was unhappy that, you know, I had no boobs and other girls did, and all my friends would go to the stores and buy, you know, Victoria's Secret's bras and whatever kind of bras they wanted, bathing suits, didn't have to worry if they were lined, if they were padded. So I got to the point where I felt I was old enough to make a decision on my own and that I'd like to look into getting breast implants.
I think that Jen is a very sweet girl. She's determined, she knows what she wants from life. She's a successful model, so life is good for her. And she's not bitter. With her I went really into depth. She has a lot of questions and a lot of good questions.
When I had first gone into the office to meet Dr. Blau, and he called me in, what I liked about him was he asked me what I wanted. And I showed him pictures, and he said, well, you know, you're a little too thin to go either this big, or you're a little too this to do that. You know, I like that he told me that there were certain things that I could not do.
With everybody, not only with Jen, it takes at least an hour of consultation and a lot of material to read after it in order for a patient to be ready. It's not a bad idea, like she did, to see a few plastic surgeons and then decide who do you think is the plastic surgeon for you.
I saw other doctors, I looked at their patients' pictures, before and afters, I spoke to some of their patients, and then when I saw Dr. Blau, just the whole atmosphere in his office was just, you know, amazing. I felt so comfortable. When I met him, I felt confident that he could achieve my goals for what I wanted for myself.
I saw the before and after pictures. I saw what they looked like before. You know, in terms of his work, in terms of what, you know, I've seen, she looks good.
It's definitely your decision. It's not your boyfriend wants you to have big boobs. It's not the industry wants you to have big boobs or small boobs, or, you know, whatever it is. It's what you want. Because at the end of the day, it's you who's living with it.
If they feel they have a small breast and they want to look better with a shirt or with a bathing suit, and they want a nicer cleavage, a more sexier look. If they feel the need of this, they should do it. Not if somebody else tells them that something is wrong with their breast. That's the wrong way to do it.
My father wasn't for it, my mother was, and I was just like, I'm paying for it. My decision, my body, my life, and that's what I wanted. I'm a thin girl, so I didn't want to have, you know, balls on my chest, and I didn't want to look too fake, but at the same time, you know, I'm paying for a surgery. I don't want to look, you know, too natural either.
A breast augmentation, like any kind of cosmetic surgery, is not for everybody. It happened to be the most popular plastic surgical procedure for women, and especially for young women. In the US alone, there are 350,000 women a year or more that are having this procedure. The ages that we do it are starting from 18, and even women as 50, 55 years old are doing it. Basically, it's cosmetic surgery, it's surgery for aesthetics, and the results are extremely important.
He's also an artist. If you go into his office area, in the waiting room, he has his art displayed everywhere. An artist is, you know, very precise and meticulous and, you know, not necessarily a perfectionist, but Dr. Blau, his work just caught my eye and saying, wow, if he could do that and make, you know, that clay look so perfect and portray, you know, a female form so perfectly, then, geez, I'm probably in good hands here.
I would say that well over 95% of my patients are happy. You can learn from Jane. She interviewed a few plastic surgeons, she read a lot of literature, she asked a lot of questions, and she gave me her opinion, what she thinks she should look, and I gave her my opinion, and we kind of compromised. Obviously, she was happy with the results.
I go to the store and it's kind of bad because I buy everything. I buy bras and I don't even have to try them on. I buy tons of bikinis. I probably have over like 60 when before I had to find certain bikinis that were lined so that I could put pads to push, you know, the little that I had up to make it look like I had anything. So I'm really happy.
We came to the right conclusions together.